Hi, this is Scott Pop for Mobility Minute. We're going to talk about what happens with hip dysfunction that would cause knee problems. Almost always, it is a tightness in the external hip rotator system. This tightness and weakness produces malalignment of the hip, and it also translates into extra strain going down the IT band. A lot of people complain of chronic tightness in their IT band that it'll never go away. Well, it's many times coming from the tightness in the hip rotators or the lower back, even up into the scapula sometimes also. So what we do is we evaluate the tightness, and you can just basically go up and across. If you just feel tightness in through the external hip rotator system, you probably need to treat it. Now there's a couple of ways to treat it. You can passively stretch it, or you can use a lacrosse ball and a foam roller. I prefer to start with a lacrosse ball in through the hip rotator system by laying on it and on your back and rolling this out in through here. Then you want to take a foam roller and roll out your IT band, take the lacrosse ball, and even go up into the lower back here, just finding the tender areas, releasing this. If you have pain in the front part of your hip here, it is often because of tightness in these back muscles causing your ilium to go into flexion and causing what's called an anterior impingement. The tightness in the back is what so many times causes the anterior pain of the hip, and it's more common in females than in men. So work the lower back, work the hip rotators. You can use the lacrosse ball on the IT band or the foam roller, and even get up into the rhomboid muscle between the shoulder blades, because this lateral chain all works together. There are some passive stretches that you can do, and one is essentially like this. So you can take your hip up on something like this and go forward and stretch pretty deep. This could be the floor also. You can just come over and go across like this. This is a good passive stretch. Again, when you drive and sit in your car, you can take the lacrosse ball and get it into that hip rotator system. In your seat of your car, you can put it back here and work that lower back. Again, you can just lay on your back like this and work it. Pretend I'm a hard floor. Get it underneath of the hip. Roll up on there like that. In this video, we're not going to talk about exercises, just stretching and mobilizing the hip system. In the majority of cases, that's all that's necessary, and it will greatly improve the stress to the knee by getting the hip to rotate better, to take off that stress, the rotation into the knee. So, this is Scott Pop for Mobility Minute. I hope this helped, and next video we'll talk about some exercises for the hip. Thanks for watching.